I've been getting some questions about ACL reconstruction. This, of course, is a topic that's near and dear to my heart because this is the surgery that I had. I dislocated my left knee 4 times and partially tore the ligament in my left knee. The ACL is the anterior cruciate ligament. It's a specific ligament. You generally have 2 ligaments that cross in the bones from the femur, the bone in your upper leg, and the bones in your lower leg. You have the ligaments that cross, and they hold your knee joint in place. Well, when you stretch that ligament too far, and like I did 4 separate times, I partially tore the ligament in my knee. The ligaments do not have its own blood supply, so it takes very long for it to heal. When the ACL is partially torn, there's this sense of the knee will lock up. And when I went to the doctor and he did the test on the knee to check and see where the ACL was, my knee was very, very, what they refer to as sloppy, meaning it's very loose. And went to have ACL reconstruction, where they use 3 different types of body parts to repair that ligament. They use a patella tendon, which is your kneecap. They slice part of the kneecap tendon, or they use hamstring, which is part of your hamstring muscle, to reconstruct the ligament in the knee, or they'll use a cadaver, which means they'll get another ligament from a person. You know, when you write on your driver's license, it says, I'd like to donate body parts. This is what they're taking out and using in an ACL repair. There's pros and cons to all of them. The pros to a patella replacement is the fact that everything is done in one place, meaning they took, this was the knee that they did, and they cut part of the tendon. They cut part of the tendon out and put a pin in my lower leg and a pin in the upper leg and attach that tendon to reconstruct it. All of the pain was localized in just one spot as far as the patella tendon repair. The pro is that it's all localized in one spot, and the con is it's localized in one spot because it's extremely painful, because you're not only rehabbing the injury from the ACL, now it's very difficult to kneel on your knee because of the scar tissue from where they cut out just below the kneecap. So that's as far as the patella issues. As far as the hamstring issues, it's a different dynamic. They're taking part of your hamstring, which is the big muscle behind your leg above your knee, and they repair that, and the pain with that is different. I've not had that personally done. However, I've worked with clients that have had that done, and that can be somewhat painful in their hamstring as far as stretching their hamstring, moving, walking, and things like that. So that is a different type of issue. The pro with it is that there's not the difficulty with kneeling after the surgery. Probably the best, however, is the cadaver. And the cadaver replacement is where they're taking the ACL, the ligament, and repairing the ligament in your knee with a cadaver coming out of a deceased person's knee and repairing that. The pro with it is that it's not hurting you, right? It's not affecting anything other than they're repairing what you've damaged in your knee. The cons is that tends to be a more expensive surgery because you have all the dynamics of getting that to you, the ACL to you. Another con is that there's the chance that the ligament can be rejected. Like you're taking a foreign substance and putting it in your body, and your body sees it as like a foreign piece of material, and there's an opportunity for your body to say, I don't want to deal with that, so it can kick it out. So that's kind of a con with that. So those are the three main approaches to ACL reconstruction. Once again, I did the patella replacement. In my experience, it took a while after that ACL reconstruction to get back to normal. However, knowing what I know now, it would be such a shorter period of time by addressing those tension patterns, taking the knee to comfort, and getting the body to release those tension patterns, which makes it hurt longer than it needs to after the surgery. It's my belief that if you set up the conditions so your body is able to heal itself, you remove all those blocks, your body is able to heal itself very fast. So that is what I would do, and the place to start would be to work with my program, The Comfort Zone, and that's going to create the space in the knee joint, getting the pressure off of those nerves as soon as you can after the surgery, because the more blood flow you have to the knee, because when the ACL, when it snaps, it's like there's this pop, and it's excruciatingly painful. And the more we can address those tension patterns in the nervous system and get your nervous system to drop down and relax so there's more space, the faster your body is able to heal itself. So that's my approach to ACL reconstruction, and see which one fits for you. See which one works best for you in your financial situation and what you see. Ask your doctor about it. See all the different pros and the cons. There may be different approaches or different perspectives that your doctor may share on this, but it's important to get as much information as you can as far as to make an educated decision on what's best for your body.